Sorry. Okay, awesome. Well, good evening, everyone. We're just so glad that all of you have made it this evening for our actually second iteration of a faith and pharmacy discussion regarding mental health equity issues. I'm Angela Hill, the Associate Dean of Clinical Affairs and Professor at the Tenacia College of Pharmacy and Project Director for We Care. And We Care is an acronym that stands for Work Group Enhancing Community Advocacy Research and Research and Engagement. And so I wanted to also acknowledge our other team members. We have Mr. Hiram Green, who is on board. He is the community relations contact for the Tenacia College of Pharmacy. So, Mr. Green, you could wave your hand. And then we're fortunate to have one of our primary community partners in the person of Dr. Deborah Austin, who is also all things community relations for Reach Up. And Reach Up is an organization that addresses child and maternal health. And so we are just so fortunate to them because they address and handle all of our technicalities and organize these kind of meetings for us. And then we have a shared passion for helping the community at large. And so we're just so happy to have them here. And on behalf of Dr. Kevin Sneed, our Dean and Executive Director for We Care, he sends his best wishes and just wants to share in thanking all of you for attending tonight. So I will start things off by just saying that this is an effort to collaborate with the Association of Black Health Systems Pharmacists to try to close the gap in health disparities as it relates to mental health. We Care actually has basically two major missions, one of which does focus on health disparities, but the other is primarily focusing on helping our research community with diversifying their recruitment efforts and then ultimately retaining said participants. And so we do love to collaborate with organizations that are giving attention to issues that we know impact these marginalized communities. So I would like to take a moment of pause and allow our next major co-host in the person of Dr. John Clark to present himself, and then we will allow the rest of our team that'll be talking tonight to introduce themselves. Dr. Clark?
Good evening, everyone. I hope you can hear me. I'm here tonight in a sort of a multiple different roles, but one of the main roles is to represent the Association of Black Health System Pharmacists. We use the acronym ABHP. ABHP has been around since the early 1970s, late 1970s, actually 1978 was when they first got together. The organization had been somewhat inactive over the last 3 or 4 years, and we're in the process of trying to revitalize the group. We're going to launch off again with a lot more stuff starting in 2024. But the group started back in the 70s, similar to it was at the time the second Black Pharmacy Association in the country. The National Pharmaceutical Association started around 1947 as the first one. Actually, it really wasn't the first one, but I won't go into that now because I'm going to be presenting at the Student National Pharmaceutical Association meeting in New Orleans in July. And my presentation is going to be on the history of the Professional Pharmacy Association. There were others before NPHA, but the one that became still around today from that period is the NPHA. And so ABHP was the second one after that. And so our focus mostly had been on the hospital health system side of pharmacy practice, where mostly it started out as being called the Association of Black Hospital Pharmacists, and now it's the Health System Pharmacists. And we use an acronym, it's been around for a while, called CLEAR, because when we started out, people didn't know what the group was about. So we in our mission statement, we coined the acronym CLEAR, which stands for what it means in terms of our mission is that we are an organization that collaborates, where the C comes from, And we also promote leadership, advocacy, education, and research. That's where the CLEAR comes from for the betterment and of minority health care, minority health patients, and to elevate the vision of minority pharmacists in the health system. So that's a way we started to provide that to our boards to be able to describe our mission and vision of the organization. So, and I won't go any further than that. I think it would take up a little bit too much more time, but I'll be welcome to talk about it later. Now, I'm trying to, you see the slides are not advancing here.
Dr. Clark, try to stop sharing and reshare.
Okay. Okay, let me try again here. Are you able to see the screen, the title screen?
Yes, sir.
But it's not advancing. I can't get it to advance here.
Well, let me try to share mine and I can be your Vanna White.
Yes, yeah, try yours. Let me stop sharing here and see if it works.
Okay.
Go to the second slide, please.
Okay.
Okay, very good. Thank you, thank you. So what we're going to try to accomplish tonight is to look at the roles of pharmacists in the healthcare delivery as it relates to mental health, and look just briefly summarize the importance and impact of spirituality and faith when it comes to how patients are able to overcome different mental health around certain diseases. And I'm glad we got some pastors on the line, because I'm gonna let them really explain this better than I can. Then we're gonna look at ways that pharmacists can help support the faith-based community around mental health and build this a collaborative partnership. That's what we want to really get to here. So can I have the next slide? So I wanted to go into a little bit of information to talk about the importance of spirituality and faith as it relates to us getting to that point. Can you advance the next slide?
I can't believe it is frozen on me as well. Dr. Austin, do you have the slides?
No, I
No?
don't.
Oh, okay, hold on. Let me stop sharing and see if I reshare. I cannot believe that.
Yeah, happened.
Yeah. Yeah, it won't advance. So, okay. Let me try something else here.
So maybe just leave it in that mode there.
I think it moved.
Yeah.
Yeah. Okay.
So yeah, there we go. So and I'm hoping that we got some pastors on the call that can help elaborate on this. I'm going to go through a few very briefly some things to highlight the importance of spirituality and faith. Can I have the next slide if you can move it, Angela? Okay, so well, spirituality is defined oftentimes as an aspect of humanity that refers to when an individual seeks to express themselves for the purpose of related to their experience and their connectedness to a moment in time. That's why you may see people who may be going through some things and they have especially in the Black community, they will stop for a moment and give a prayer to get them through a situation that they're in. But the spiritual well-being is a balance of those things as it relates to their relationship with God. Can I have the next slide? So
I cannot believe this.
yeah, that's amazing.
Yeah, this has never happened to me before like this frequently.
Okay,
Yeah,
well,
I am not.
I'll
Okay,
keep going from my slide here. But
okay.
there's a couple of areas where it has been shown from research, and I won't go through all of those. I'll point out a couple of them where it's been shown through research that there is a strong correlation to health outcomes in based on the level of spirituality in situations such as post-traumatic stress. There's like a high level of spiritual well-being that leads to a feeling of hopefulness. Also, in patients going through post-traumatic stress, there's research that shows that there are suicide ideations begin to go down based on that level of spirituality. That is also seen in cancer patients. There's a high level of spirituality and well-being. Those that have a higher level usually shows less depression. They cope better with what's going on with them. There's less negative emotions associated with them dealing with cancer. So that becomes important, and there's research to back that up. Also, when you in other areas has to relate to just some of the effects that occurs with certain chronic illnesses, such as desperation, such as the anxiety, that those patients that has a higher level of spirituality seem to have they're less desperate, and they seem to have less depression associated with that. Also, there is the importance of them consulting with their spiritual advisor. That could be the pastor from that church, or it could be some other advisor that they seek when they're having difficult time. That becomes important. There is an increase in the efficiency of the treatment of mental health and other diseases. And one in particular that we can focus on in pharmacy is medication adherence. That tends to go up with the level of spirituality. And so those things become extremely important, that we don't leave that out when we are, as providers, trying to work with patients that have terminal diseases or even some other mental health diseases in particular when we are in our practice. I don't know if you can advance to the next slide, but I wanted to talk about just briefly the importance of medication adherence. There are 4 or 5 areas that have really been studied as it relates to medication adherence. There is an increase as the level of spirituality increases. There's an increase in their commitment to the treatment. They tend to it elevates their faith in the treatment. That's important, especially we see in certain patients who have a negative attitude or perception towards our healthcare system. It gives them hope for recovery. It also increases their with the physician efficacy in their treatment. So they're more likely to adhere to the treatment regimen, and there's a high level of adherence to medication therapy as well. The next slide, if you can advance that, please. So these are a couple of areas where they've shown through research where it makes a difference. Age is one. The younger the age, those groups between age 18 and 28, and I know that some of the pastors here may have an experience with that. I would love to hear their responses to this. But that group seem to have a higher level of spirituality. You would think it would be the older group in my mind, but the younger group seem to have the highest level, but it's not statistically significant. But the pattern is there. Those that have the level of education, it seemed to have been more statistically significant, but higher in patients with higher levels of education. So the higher the spirituality, the higher the education, usually the higher the level of spirituality. And that has been found to be statistically significant in research. Marital status, those that are married seem to have a higher level of spirituality, but that hasn't been shown to be statistically significant. Our family history makes a big difference. Those who have a strong family foundation, they tend to have a higher level of adherence to therapy, but that's haven't been found to be statistically significant in research. But in higher incomes, those who have higher incomes, there's a statistical significance of those that have more spirit. The higher the level of income, the higher the level of spirituality, the better the outcomes or adherence to medication therapy. And employment status, those that are employed tend to have better outcomes and with the level of spirituality, but that hasn't been shown to be statistically significant. Now, and later on, we're going to have we're going to open up on this because I think depending on certain experiences, certain churches, certain locations, this may vary. And I think that one of the things, and it's okay that it varies, because if we're going to make an impact on that, we have to meet people where they are at that time. So this research is good, and I think it gives us an evidence-based way to look at it. But we know that when you're dealing with this, especially how we're looking at mental health in the church, that we meet them where they are. And so it may not be in this research data. Can I have the next slide, please? So at this point, I'm going to stop it there with the spirituality part, and we'll pick that up again in the open forum. But I wanted to introduce Dr. Moore. She's been working at the University of South Florida with me and her. I'll let her tell you a little bit about her, especially so I won't make a mistake in introducing her. So Dr. Moore, can you introduce yourself? And she's going to talk about the roles that we play or can play as pharmacists with mental health.
Good evening. Again, my name is Taya Moore, and I am an associate professor at the University of South Florida, Tunasia College of Pharmacy. But as part of my role there, I have a clinical practice with the University Psychiatry Center. And what that means is I focus as the clinical pharmacist at the Outpatient Psychiatry Center that's run by the Department of Psychiatry for USF. And so that's currently what I'm doing now. I've also practiced before in the hospital, and a few other settings, but I'm going to talk some today about what roles and what things that we as pharmacists can do to assist in mental health, or teaching people about mental health and having people understand kind of the role that we can play. Okay, and so we have divided this section up into 7 distinct service areas. And so throughout this portion of the presentation, I will talk about access to pharmacy, or access to services, adherence, which we heard a little bit about already, coordination of care, medication therapy management and review, education, and that's for healthcare professionals and for those in the community, disease state management, and resource provider. So the first area of access, then the things that we look at are the pharmacist's ability to assist as needed with difficulties in accessing medication. So many of you have probably seen in the news lately how there are shortages of many medications right now for a variety of reasons. So supply is compromised because of supply chain demands, and then the demand of medications has increased over the years. So working in psychiatry, for example, one of the big things we're facing now is stimulant medications, and people who are using those for attention deficit, hyperactivity disorder are unable to get their medications. So pharmacists are one of the key groups who can assist with accessing medication, whether it's because of shortages or because of difficulties with finances, helping people understand some different ways that they can access their medications. Other ways that we can help with access include, streamline pharmacy visits and the refill process. So making it easier when people come in, for example, to their pharmacy to see and talk to the pharmacist or the pharmacy intern, and then make that refill process or getting their next doses of medication more easily. And finally, connecting consumers with medications by, again, using our knowledge to navigate some of the channels that may be challenging for the average person. Next slide. And next, we're talking about adherence. So how well is a person able to maintain or stick to the regimen of taking medication that they've decided upon with their healthcare provider usually? With this, we can improve and sustain an acceptable patient adherence to the drug regimen, and so pharmacists can help with that. And also pharmacists can help to ensure there's no time lapse between refills. So it kind of combines that access, making sure that people are able to get their medications in a timely manner. Next slide. Coordination of care. Pharmacists can help with coordination of care with other healthcare providers as relates to the patient's drug therapy and overall health. So an example of this would be at the psychiatry center, I work with a psychiatrist, sometimes with neurologists, with a social worker, with a nurse. And one of the ones that I've worked most closely with in terms of helping coordinate care is a social worker. So even in the community, sometimes pharmacists know others who are in the community, like social workers, who can provide that information about resources in the community, as well as the pharmacist providing that and helping patients or people navigate some of those resources and some of those areas that may be challenging in the community. The pharmacist also can help to validate healthcare utilization and minimize the individual's healthcare cost. You'll find that pharmacists usually are pretty good at finding less expensive ways, whether that be patient access programs that may be offered by the pharmaceutical manufacturer or prescription programs. A lot of people may have heard of GoodRx, which is a way of finding better prices for medication and other resources such as that. Next, we're going to talk about medication therapy and management. And this is a big role that pharmacists play. Often what we expect pharmacists to do is to prevent duplication of drug therapy and avoidance of drug interactions, letting people know which medications can interfere or interact with each other, and not just medications or drug-drug interactions, but which medications interfere with foods that you may eat or vitamins that you may take. So all of those things are within the realm of what pharmacists can do to help evaluate appropriateness of medications. So whether or not it's appropriate for that particular disease state, or taking other factors into consideration like age, gender, income, ethnicity, culture. All of those are things that we look at in terms of deciding whether or not a certain medication may be appropriate for a person. Ensuring evidence-based guidelines are followed for conditions and medications. So not having people take medications just because someone said, oh, we think this will work for you because we like this medication, but actually looking at the evidence and the guidelines that tell us, we've tried this in this type of patient, in this setting, this number of people, and it's worked well. Making sure that we have the evidence to back up those recommendations. Identify, monitor for, and prevent or minimize adverse drug events or medication-related complications. So one of the things that pharmacists probably are most known for is being able to tell you, okay, this side effect is associated with this medication, or this adverse effect may happen if you're on this medication and you have this particular disease or you have this other issue going on. Also, pharmacists can assist primary care providers, so those people that you see in the primary care clinic, and monitoring patients' drug therapy and medical conditions, particularly response to therapy between provider visits. One of the known facts, or one of the things that's often stated, is that pharmacists are the most accessible healthcare providers. It's been shown that people are probably seeing their pharmacist 3 to 4 times more often than other healthcare professionals. So you may see your physician once every 6 months. You may see a nurse maybe more often than that, but most people, especially if they're on medication, it's not unusual that they'll see their pharmacist at least monthly, and then possibly more often than that. So between visits of seeing those other healthcare providers, then you have a resource or a person that you can talk to about how your medication is working for you, how therapy is going. Recommend to the patient and primary healthcare provider preventive measures when necessary, such as immunizations and routine laboratory tests established by evidence-based medical guidelines. So again, using those guidelines that have been established to also let you know about immunizations or laboratory tests that could help determine and help us understand how you're responding, but also could potentially help prevent problems in the future or other issues. And next, we're talking about education, incorporating the patient participation in self-care and self-management of medication when possible. The foremost thing that we want for patients is that each person is able to advocate for themselves or manage on their own. The pharmacist or any healthcare provider is there to assist, but ultimately the patient is in control, or the person that is receiving therapy is the person that's in control. So making sure that you're able to manage things. Improve patient satisfaction with healthcare as it relates to his or her drug therapy. So again, being that person there, making sure that you have someone to talk to that's able to understand and assist you if you are satisfied or not satisfied with that drug therapy. And amplify patient and caregiver education on purpose of drug therapy, proper medication use, and expected adverse effects and important adverse reactions that need to be reported. So if you do have something happen to you that's an adverse effect or reaction to a medication that you're taking or a therapy that you're receiving, that you know how to let that be known and report that to the proper agencies. Disease state management. So we've talked about these a little bit already, but pharmacists are your go-to professionals also for services to providers regarding long-acting injectable medications. So that's something relatively new that pharmacists are able to do in terms of providing long-acting injectable medications, comorbidities, smoking cessation, and disease prevalence with diabetes and other chronic disorders. So again, the other practitioners or patients or consumers can use pharmacists for those consultative services. Pharmacists can also maximize benefits of the various therapies while reducing occurrence of adverse drug events in the ways that we mentioned and talked about before, provide cost-effective service to patients and healthcare providers, and finally, improve patient caregiver understanding and compliance by providing continuous patient caregiver education. So again, as the drug experts, then pharmacists are in an ideal position to give education and information about medication therapy. And that takes us into resources, or pharmacists as resource providers. So you have access to pharmacists in the community and elsewhere, and pharmacists have that ability to link consumers to patients and caregivers with appropriate healthcare resources, provide healthcare professionals with pertinent and allowable information regarding the patients and their care, and then serve as reliable sources of education on medication use and medication processes for consumers and health professionals. And so to sum all of this up, and I'll go through this one relatively quickly, then again, those key pharmacist actions are in terms of access to assist as needed with difficulties in accessing medication, streamline pharmacy visits and the refill process, so making sure that you're getting those therapies and medications efficiently, connect congregants with access channels to better adhere to recommended therapy from providers, and medication utilization in terms of adherence, improve and sustain strategies for adherence to medication regimen, ensure there's no time lapse between refills to ensure continuity of care. So making sure that it doesn't happen that people run out of their medications or aren't able to take their medications because they're not able to access them. Coordination of care in terms of assisting in coordinating care with other healthcare providers as it relates to accessing mental health systems of care. So in the community, a lot of times, many people don't know where to get mental health services. And so pharmacists can be one of those resources to let people know how to access the mental health system. For education, incorporate patient participation in self-care and self-management of understanding psychiatric medication when able. So making sure that people understand what they're taking, when they're taking it, why they're taking it, all those sorts of things. Provide patient and caregiver education on the purpose of medication therapy, proper medication use, possibility of adverse effects, and then learning objectives to support healthcare providers on education related to critical issues of health equity related to severe mental illness, increase recognition and awareness of the multicultural health concerns that affect individuals with socioeconomic disparities, and establishing best practice models that address the issues of equity and disparities in mental health from a pharmacy lens. And finally, disease state management. So providing those consultative services with regard to other disease states also, like anticoagulation therapy, hypertensive, hyperlipidemia, smoking cessation, diabetes, and other chronic illnesses, to maximize benefits of the various therapies while reducing the occurrence of adverse drug reactions, and to provide cost-effective service to patients and healthcare providers, and finally, to improve patient caregiver understanding and compliance by providing continuous patient caregiver education. And I know I've said that many times, but also in the work that I do, I actually work in a memory disorders clinic. And it may surprise you how many people say, well, I take the medication, but I don't know what I take it for, or I just take what the doctor tells me to take. So again, I think it's important to have people understand not just what they're taking, but why they're taking it and what they're taking it for. And I think that was all for my area. So I am going to turn it over to Dr. Cherie Allen to talk with you a little bit more on this topic, but go into kind of what she does and some more about psychiatric pharmacy.
Hi, everyone. Again, thank you all for joining us. My name is Cherie Allen. I am an associate professor at, it's a very long name, Philadelphia College of Osteopathic Medicine, School of Pharmacy, but the Georgia campus. So I practice as a mental health pharmacist here in Swanee, Georgia. And similar to Dr. Moore, I teach at my school, but I also get the opportunity to work with our veterans at the Atlanta VA. And I've worked inpatient pharmacy or inpatient hospital pharmacy here in Georgia as well at Laurelwood. It's a inpatient psychiatric hospital in Gainesville, Georgia. And then a little on my own time, I've had the opportunity to work community pharmacy at one of the chains here in Georgia as well. And so what I get to talk with you all about today is more specifically, Dr. Moore talked about how pharmacists can be the most accessible of the healthcare providers, but I really think that it's our community healthcare, or it's our community pharmacists that are the most accessible, that our patients see once a month. So we're going to talk about what are some things that specifically our community pharmacists can do in bridging that gap for our patients with mental health needs. So again, Dr. Moore talked about how the pharmacists are the most accessible, but one of the things I will admit, or some of the feedback that I get from our community pharmacists, is while Dr. Moore and myself and Dr. Hill and Dr. Clark may specialize in mental health, not all pharmacists are very comfortable with this area. But that's why that's an amazing opportunity for organizations such as ABHP, our alumni organizations, to provide training to our community pharmacists so that they can feel more comfortable with addressing patients that have mental health related needs. And so that training might look like an update on the mental health medications. It might look like how to administer long-acting injectable antipsychotics. It might look like what disease state management looks like for patients who are on mental health medications. Mental health care services, again, like Dr. Moore had mentioned, mental health care services, particularly in the rural areas, can be very limited. Even me, I live in the city, and it can be months before I'm able to get in with a therapist or a psychiatrist for my own needs. And so again, our patients also have that same barrier to care. But your community pharmacists, there are often pharmacies in multiple different areas, including rural areas in the city and in urban areas as well. And that's why they can serve as, again, bridging that gap or filling in the need between when they're able to go, before they're able to go see to see a different provider, a different mental health care provider. And so one of the things that our community pharmacists can do is work on medication management. Again, biggest example would be when patients come to the pharmacy, and sometimes we can see things like movement disorders, or we can see that maybe they are not picking up their medications on time. Pharmacists that work in the community setting are able to pick that up and able to relay that message to their other providers, and again, act as the in-between for that care. Myself, I worked on, when I was not at the VA, I was able to work on the ACT team. And on the ACT team, I was able to go out to patients' homes that lived far away from the hospital, and we would give them their care in their homes. While I'm at the VA, we have a team called the MICM team, and I get to do something very similar. So I get to go to patients' homes and train them on why are they taking their certain medications and setting up their pill boxes for them. And then our nurse would come with us and help to give the injections as well. As a pharmacist, again, one of the things that I do at my site is I manage the mental health medications for all of our veterans. And so for me, that looks like seeing, making sure they have a diagnosis before they come to me, but making sure the medications that they're on, are they working? Are they appropriate? Are they the best for their needs? But one of the ways that I'm able to assess or to tell if medications are working or if they're doing well for them is I give assessments or mental health screening tools. I use things like PHQ-9 and GAD-7, but also because those are patient rated or self-rated, our community pharmacists, that's another tool that they can easily use in the community setting in order to be able to help patients assess whether their medications or whether their symptoms are controlled or not controlled, and then relaying that message to their providers. Dr. Moore also talked about long-acting injectable antipsychotics. So it is one thing to have patients on long-acting injectables, but your patients have to be able to go to the facility or go to a clinic and get it. Again, one of my patients lives about 60 miles from the hospital. And so while he only has the injection once a month, he does not have a car. It is kind of a hassle in order to be able to get him to the clinic once a month to get this injection. But then again, that's where community pharmacists can come into play. Is some of our community pharmacies, community pharmacists are trained in giving these long-acting injectables. And so for patients that may not live near clinics, that's important because they're able to go have more access to that care. Another big role that our community pharmacists can play, and I'm starting to see a lot more of this, is metabolic monitoring. So as you all know, our antipsychotics in particular can cause some metabolic disturbances. So we can see increased lipids, diabetes, we can see increased weight gain. But as Dr. Moore said, sometimes we don't see our providers, our primary care provider or a psychiatrist or your therapist. You may not see them until every 3 or 6 months. And so ideally, we want to catch things like diabetes and hyperlipidemia. We want to catch those things early. And your community pharmacists can be trained and are trained in order to provide those point of care testing and then be able to communicate that to the primary provider. And then lastly, I think our community pharmacists are going to do a really good job or can do a really good job at educating on patient-specific resources depending on where the patients live. So Dr. Moore mentioned in her presentation, or her part of the presentation, is educating on what resources are available. It would be very helpful, and it is helpful for our community pharmacists to know the resources that are available in their area and to be able to communicate that to their patients. And so what I'm hoping that we'll see is we have such a great opportunity for our community pharmacists, not only specialty psych pharmacists, but your community pharmacists to play such a large role in bridging that gap in the mental health care system. And so with that, I will turn it back over to Dr. Hill to further the discussion.
Well, I'd like to thank Dr. Allen, Dr. Moore, and Dr. Clark for setting the stage for our open forum component of the program. I think the information that they shared really explains why we're doing such a meaningful program. And I'd like to comment that just like Dr. Allen and Dr. Moore, I too have experience with mental health. I've worked in psychiatric hospitals, I've worked in the retail sector, and my most recent work, the past 10 or 15 years, very similar to Dr. Moore, I've worked in memory disorder clinics and other primary care related clinics. And what I will say is anytime that there's a pharmacist in any of these environments, we become one of the most popular health professionals out of the team, because most times one of the things that we can do very well is certainly monitor the whole patient. So you mentioned, or you heard Dr. Moore mention a couple of times about the importance of identifying drug interactions. And then Dr. Allen went on to explain issues of access. And so what I will say about the community pharmacists is that we're able to not just address their mental health needs, but also look at how the medications we may be using to treat their mental illnesses can impact their medical problems, as Dr. Allen kind of alluded to, which justifies why we might be involved in monitoring. But we also can be a very great source of information to the providers and the prescribers for those in-between visits. So one of the things that I wanted to do before we started our forum is just comment on some opportunities that really kind of level the playing field in terms of people upskilling as it relates to being knowledgeable about psychotropic medications and things of that nature. So we're currently also working with the Florida Blue Mental Health Training Program, which is designed to provide some fundamental training to individuals that either want to upskill themselves or just really kind of gain a lot more insight about medications used in the mental health space. And so we'll be happy to share information about that as we continue with the program. The other thing is that we have also worked on, We Care has worked on a resource guide that includes national as well as some state affiliated organizations, community-based organizations, online resources, mobile apps, and other things that can be used by pharmacists and other health professionals. But also, since we have a few clergy on the lines, these are things that could be shared with your congregation. So with that, we're going to move on into our forum, and I'd like to allow everyone to unmute themselves, perhaps, and turn on their camera and have a discussion and see if we can answer these few questions here. So this is the opportunity where everybody can kind of introduce themselves and share if you're a healthcare professional and which discipline, if so, and then also if you're affiliated with a faith-based organization, you can also comment. And so this will be an opportunity for everyone to participate, including our speakers, and talk, really about how these questions relate to your particular area. So our first question, we'd like everyone maybe to discuss how your faith-based organization supports mental health within the congregational setting. And I'll jumpstart things. I'm a member of a non-denominational church in the Wesley Chapel area. And prior to, and especially throughout the pandemic, our pastor affiliated with a husband and wife therapist team that actually served as a supporting resource to our health and wellness committee to provide individualized counseling services. And we also did have done a series of online discussions about mental health topics or webinars about mental health topics. And then we've, also created opportunities for the church congregation to meet them individually. And that has been extremely, extremely helpful. So with me having said that, I'll stop there and see maybe if someone else wants to chime in about how their faith-based organization is supporting mental health within their congregation.
Well, I'm Leonard Edlow. I'm both a pharmacist and a pastor. And
Welcome.
the greatest challenge that I've had as pastor is removing the stigma associated with mental health. And people have even gone as far as the passage where the boy that had epilepsy, that he was demon possessed. And so it's been very hard. I had actually he was a boy, and he had an educational learning disability, and his parent didn't want him to be baptized. So I had to overcome that. And then because a lot of people know that I'm both a pharmacist and a pastor, even people who are not in my congregation, the cost factor is a problem for a lot of people. And what I've been able to do is direct them to the manufacturer to get the coupons. And it bothers me. I'm in a very rural area that the pharmacists there don't take the time to do this, because it's so important. And then naturally we have our health committee, and it's holistic. And I try to include, all factors, especially dealing with depression. And now a big push I've had is towards trauma, because so many of us suffer from intergenerational trauma. And then I was speaking on another call on Sunday night, and just the mistrust with medical science. I'm working on a commission with the VCU health system because so many things have happened there that adversely affect people in care. So it's a lot to be done. And a final thing, I consulted, even though I'm back in community pharmacy now, where we do the injections and all this medication therapy. We even do medicine on time packaging. But for about 3 years, I did consulting medical advisory committees at prisons. And
Mhm.
mental health is a big problem there. And it's hard to get past the point of why do I call them patients, they call them inmates, why they even need some of these expensive medications, because
Mhm.
the local jails don't have the benefit that the state does with contracts. So
Mhm.
pharmacists can do a lot, and on the
Mhm.
pastoral side, we need to do a whole lot. I think as pharmacists, we need to engage clergy more,
Mhm.
a whole
Mhm.
lot more, because a lot of them are uncomfortable talking
Yes.
about the topic. But and then
Mhm.
theology has a lot to do with a whole lot of things, because a lot of people, I've on the theology side, I've done a study of the rural Black church in the South, and a lot of
Mhm.
people, rather than getting treated, they feel like it's better to die because that's the only time they have respect in life.
Okay. Very good. Well, wonderful things. And I think it's so important, like you said, that pharmacists approach clergy, make the clergy aware that they're in the congregation and certainly a resource in that regard. One of the things that I forgot to also mention is our pastor actually sacrificed Bible studies to discuss, have topics regarding mental health initiatives that allowed individuals working in that space as professionally to one be aware, be a increase awareness for the congregation, but then take on certain topics related to mental health. And have I don't know if you've done anything of that magnitude, Pastor Edlow.
Well, we have
Hmm.
a
Hmm.
health moment every Sunday, so
Okay,
we
good.
do deal with it all.
Okay, awesome. Well, thank you so much. Who else would like to comment on some things maybe that their church or faith-based organization is doing?
So
I,
oh, go ahead.
I'll go ahead.
I was going to say, I have recently started attending a newer church here in Georgia. It's called Story Church. And I think it's a pretty young crowd, progressive church, but I can't speak a whole lot on it because it hasn't happened yet. But this
Mhm.
coming Sunday, we've been going through a service or a series about general health.
Mhm.
And this coming Sunday, the topic or the area they're focusing on is mental health. So I'm
Mhm.
excited how they're going to talk about how taking care of your spiritual self includes taking care of your mental health. And so again, I don't know how it's going to go, but I'm very excited to be there this Sunday, and I'm glad that they're at least bringing up this topic
Mhm.
in
Mhm.
church and making it a part of the sermon.
Exactly. Now, were you saying from the pastor from the pulpit? The pulpit will, I mean, he will be facilitating a sermon talking about health holistically and including mental health in that. So that really is exciting. Oh, that should be good. Well, as you're getting to know the church, then hopefully you'll walk away with some ideas tonight on some things that you can offer as a member and certainly as a pharmacist. One of the other things, and I'm just filling in the blanks to give people time to talk, and I would encourage you to use the chat if you'd like to as well. But our church also provided mental health first aid training, first with the members of the Health and Wellness Committee, and then as all, also opened it up to the rest of the church. And I think that's something both that anyone can take the training. You don't have to be a health professional to do it, but you also can become a trained trainer. And I think that's an opportunity that pharmacists can and should consider also as a way to, again, skill people with background on mental health and how to deal with it, in acute situations. Okay, now there was someone competing with you, Cherie, when you started talking. So
Uh,
whoever that was, feel free to talk.
It was myself. It's myself, Stacy.
Hi, Stacey.
I attend. Hey guys. So I attend Bible-based Fellowship Church here in Tampa, and it's actually so it's kind of multifaceted with us, which is something that we really appreciate with our church. So our pastor has done everything from have community talks. We actually just had one. I think it was 2 weeks ago.
Mhm.
Literally 2 weeks ago, where he called in even different aspects of the mental health profession. So he had everything
Mhm.
from counselors to actual like an actual programming, like the director of one of the programs here,
Mhm.
who folks that talk about literally, the stigma around the medication and why we shouldn't have that, which included even someone that deals, in the profession, but also has mental health. And so she was able to give the dual fold kind of testimony to the whole situation. And then as well as dealing with folks in the reentry process. So it was interesting that Reverend Edlow mentioned that, because that's something that they talk about and that they talked about. They had a gentleman that works in the prison population, and then also on the exit population, and just, dealing with those mental health issues and, things like that. So we have those community talks. So that's one thing that we've done, in calling in professionals, because of course we're not necessarily professionals, but we know plenty of them. So we call those folks in to help us out. And there is actually another gentleman, Dr. Johnson was actually at our event, who Dr. Hill and Dr. Austin know here locally, but he's a young pharmacist here, and he was actually on that panel as well. So he was able to give the medication side of things. So that was really helpful to have, kind of all of those aspects, and kind of someone from each of the sectors to be able to kind of break those things down. So that's one thing that he's done. And also we have been offered and shifted the direction of that mental health training. So it's been offered through our church several times, the mental health training that's done here in Hillsborough County, that's actually done for free. So we've just been kind of put in a situation to use. Yes. So for Dr. Moore, yes, the church on Ehrlich Road, that's us. So yes, we have used that resource, and actually have had a lady that goes to the church, was one of the trainers one time, and just several folks that are a part of which they actually have a mental health ministry that's a part of our health and wellness ministry. And so part of our mental health ministry is that they encourage things like that. So I've actually taken that mental health and first aid training because it was super helpful, especially coming out of COVID with so many things that had happened. It was helpful, just in general, to be able to, because there was so much of that going on. It's just a great resource to have, like you said, even if you don't work in a profession, because I know, I have a home daycare for a living, but it makes a huge difference. We have some outside work. I have an organization that we started that does some basically bridging the gap of bringing the community to all of these types of resources, called Envision Resolution. And so part of that is us, bridging the gap, bringing the people to all these resources that already exist. So it's just helpful to kind of always have that knowledge as well in the midst of that. So that's our church, and kind of what we do as well.
Oh, thank you. And so you commented on the mental health committees, and those I think have become a lot more popular, especially even in Greek organizations, and a lot of your other civic and social organizations. I'm serving on a mental health and wellness committee within my sorority. And so, with the momentum that this topic is getting, maybe we'll be able to start making some headway in terms of tearing down the stigma. So who else would like to share? Or
just
again,
to
put in
piggyback
the
on that,
chat. Yes.
I was going to say, we jumped on with one of those initiatives that they had as well, and we've actually hosted that. So doing some of those out of the box things, I forgot about that. Hosting some of those out of a box, like expressions events, like the Deltas have done, has helpful to also take it so that people don't feel like it's a, we're talking at them. It's a different way for people to get an understanding, but in a different way. So sorry about that.
That's okay. So Dr. Austin, we'll let you go ahead.
Oh, thanks. I am a member of a church who sits on in Northeast Old Seminole Heights. And I referenced the location because it's very important for some of the things that we do. I think about a part of Dr. Clark's presentation. We do have a large number, Dr. Clark, of millennials and Gen Zers. And they don't have the stigma that that there formerly was around mental health. And so they very actively seek mental health counseling. And there are many times when they come to us, we actually spend a large portion of our benevolence dollars on really helping people who don't have insurance or other ways to get come to, be able to access therapists and counselors to do it and do it quickly. I mean, I know you can connect people to various resources, but when someone comes to you and tell you that they need help, we want to get them connected quickly. So we actually have therapists with which we have relationship consultation contracts. And so, if there's someone who needs to get to see someone immediately, we can actually send them to the person, and that person actually bills us. The member or whomever never has anything to do with with the finances about that. And with our healthcare ministry, we have everybody, so that we do have the medical folks and the pharmacy folks and the mental health folks, all part of our health ministry, so that they can all work together. And I'll just say, one of the ways that we have really been able to use community pharmacies is in those cases where the insurance company won't pay for what the physician thinks is the best medication. And so then we actually go to the pharmacist, and that's something, Dr. Hill, that I would have to say that I got from, quote unquote, hanging around you and Dr. Steven. So that is really, Dr. Hart, really knowing the importance of going to the pharmacist. Yes. And so, we're able to send those folks to the, to the pharmacist and say, the doctor thinks this is the best medication, but the insurance company won't pay for it. What kind of, recommendation can you give us? And that has worked very, very well to help us out.
Awesome. Well, thank you. I'm really impressed that your church is taking the benevolent fund to support this, because oftentimes the benevolent fund, will support food and other things in emergency, maybe help with the light bill and those kind of things. But I'm just really impressed by that. And I think that's something that's also doable. We have a vision fund that pretty much kind of goes towards the upbuild and upkeep of the church. But I like that idea about suggesting it be considered for that. Wonderful, wonderful.
And I think one other thing that I just wanted to say is that because of where we sit, we have a lot of homeless people who just walk onto our property needing assistance. And so one of the things that we do is connect them sometimes with the mental health folks that we have on our health committee, so that they can talk to them and help them to understand that part of the problem that they have is a mental health issue, and let us get connected with someone who can help you deal with those mental health issues, because that's a large part of your homeless issue.
Exactly. But that whole social determinants of health piece is also really important, because I would imagine the homeless have bigger needs that is feeding some of the mental health issues, and vice versa. And then as Ms. Ransom was talking about the reentry program, and Pastor Edlow also commented, on working with the prison system. And I know Dr. Clark has done some consulting in the prison systems as well. That's in a very special groups that really need attention. Okay.
We're really fortunate in that we were able to actually get a grant from a foundation that gives grants to religious organizations and churches, so that one of our pastors is in the role of what we call chaplain advocate.
Wow.
And he is out in the community doing that very thing that you're talking about, Dr. Hill, and that's really helping people deal through the whole social determinants of health in this specific situation.
Wow. Awesome. Well, thank you. That's really helpful. And focusing on the social determinants of health. Wonderful. Wonderful. Anyone else want to share regarding this? Let me see. Looks like we got a new message in the chat. That's awesome. Okay. So Stacy's dialoguing quite a bit in the chat. Anyone else want to share in relation to something your faith-based organization may be doing to support mental health before we go to the next question? Just want to be mindful also of time. We're a little over 8 o'clock now. Okay. Well, if there aren't any more shares and no more discussion in the chat, our next question was, what kind of activities build collaborations between the faith-based community and community pharmacists? And then what structurally needs to be done to make the alignment of the faith-based community and community pharmacists successful? Anybody have any ideas on that? I want to maybe pick the brain, Pastor Edlo, because you kind of play dual roles. Could you maybe expound a little bit upon maybe some of what you're doing? Uh-oh.
It's muted.
Oh, okay.
Unmuted.
I say I do a lot of things because I'm a part of healthcare system, healthcare foundations, and whatnot. And the thing is, it's our number one problem as pharmacists. People becoming aware of who we are and what we do. And so that's on our part. People are sitting there waiting. There is the mistrust there. It was funny. I led Poverty and Stroke for the Mid-Atlantic area, and I brought information to the church about it. And I started. You start small. When I was at Gainesville, University of Florida, my pharmaceutical care project was on health outcomes in rural churches, and I had rural churches. And I said, here's something. And I had empowered the nurses in the church to take blood pressure. So I had to wait. But finally, one person came up to me and I gave the information. And they said, he's not selling anything. And so it's this just communicating to people. And even in my busy practice, people would have questions and they wouldn't ask, and they said, well, it seems like you're so busy, you don't have time. And we have to, with all the workforce problems and our well-being, let people know that we have time to talk to them. It's about But I would say connect with every group you can. I'm on a foundation board, and we're trying to bring together the local governments, and we have what we call community service boards, and get some of this opioid settlement money, because substance abuse is a mental health diagnosis. And so it's just, it's so many, but like I said, just do a little thing, do one step at a time. And that's where I've gotten my congregation to the point where it is, even though if something new comes up, it's hard. One of my deacons has developed dementia. She's in denial about it. Her husband is in denial about it. The rest of the deacons don't want to talk about it. And so it's just like get over the boy that was mentally retarded and just preaching that mental health is just sickness. It's just like I have coronary artery disease. It's just an illness in a different place. So but connect with the groups in the community there, the Heart Association, the Cancer Association. Connect with them on that, and then you can move into mental health to help, because you become this resource. We've just got to be, we've got to be generalists. And I'm glad to meet all these people who specialize in mental health. That was a specialty I thought about doing when I was working on my PharmD, but I got back to working and went to the side. But at least I understand it. So, and then we have to advocate for more funding from government. Because there are not enough government funding, there are not enough providers, and we need to have that as an option for people, just like we trying to deal with the primary care issue, the mental health.
So you hit a topic, and Dr. Moore put it in the chat, that I think is really important. And I want to kind of twist your words a little bit, the both of you, to say that pharmacists have to do a little bit better about selling ourselves and changing the picture that most consumers have in regards to our abilities. So Dr. Austin is here to say, consequent to working with Dr. Sneed and I, she learned a few things, other things that we can do. And I would imagine you serving on those boards, is also giving people a whole different vision. But I do think that that's an area that we need to do in this, like Dr. Moore was saying, that we have to teach the public really about what we do. Now I want to give kudos to a mentor and former dean and colleague of mine. Dr. Robert Thomas is actually on this evening, and I've had the pleasure of serving on his church's, I guess we'll call it a clinic. Dr. Thomas, help me out with it. I don't want to misspeak, but the Calvary Clinic actually is set up to serve people in the community. And we have a pharmacy, dispensing pharmacy in there, and then there nurses and other services that are provided. But I think that becomes, because he took the lead in it, I think it was a good opportunity for the congregation to appreciate his talent and insight, one as a pharmacist, but then what he did is assembled a team of pharmacists like myself to actually be a part of helping shape the service delivery in regards to that. So Dr. Thomas, I don't know if you want to add to that and share a little bit more about maybe what you're doing at your church or some of the things that have taken place during the clinic, through the clinic process, in the spirit of mental health, or do you see that as a good platform as well? Mm-hmm.
Absolutely. I think that I appreciate that. And I do appreciate the input from the pharmacy committee that's set up to serve our community clinic.
Mm-hmm.
I think what I'd like to see happen is to have our health and wellness ministry from the church that in collaboration with the clinic to actually get some more training first of all for our ministry, and how we can go out and develop some of these programs on mental health to help our congregation. So I was going to ask for some directions how we can get that training for our health and wellness committee.
Well, we certainly can provide you some information on. Are you referring to the mental health first aid training, maybe as one of those trainings?
Yes.
Okay, and then I can certainly share the information from the Florida Blue Grant as well, because I think that'll be very helpful. Because actually mental health is the other pandemic that nobody's really talking about. And I know I've also been fortunate to work with Dr. Thomas with some Alzheimer's initiatives, and we've done quite a bit in that space. But you have the comorbidity of the behaviors and all of the mental issues that kind of go along with those neurological disorders as they progress. And so I definitely see, as Dr. Moore started us out talking about the need for education, it's not just about the medications. It's let's talk about all of these resources and talk about the safety nets, and mental health first aid training is certainly something that I think all churches should invest in, just like they look at CPR, or they also should consider some level of mental health training in that regard. Let me see who else is on. I saw Mr. Donaldson on, and looks like we have a couple comments in the chat. Okay, so Stacy commented on agreeing kind of with me in that regard, but I think I saw Japhis on, if I'm not mistaken. I'm trying to do a whole lot here. And I just want to make sure that everyone gets a chance to chime in on the conversation if they'd like. So if there's, again, anything that you're doing in your church or anything you're interested in, this is the time to network. The great thing is the majority of us are, I think everyone on here is a pharmacist. Mr. Green, I may have misled the group that he's a minister. He's not a minister nor a pharmacist. However, we've given him all kind of honorary degrees, and he could probably do all these things. But one of the things is that, if I'm not mistaken, he's a member at Revealing Truth. Is that correct, Mr. Green?
Exactly. Thank you,
So,
Dr. Hill.
yes.
I was just gonna say a couple of things. And first of all, thank you for all of your conversation, all the doctors who was, man, I'm a layperson. I know she called me doctor and pastor, but I'm really a layperson. And it really helped me out a lot tonight. And to help me understand, at our church, we just had a health meeting. Not a health meeting, but we had people come up to the pulpit and talk about their health challenges. And we've had several people lately that come up to the pulpit and talk about the mental health challenges. So our pastors really took a understanding of that. And so what we are doing now is reaching out a little further and to begin to how we can become more involved in that. So the information I got tonight from many of you and from the doctors is really going to help me go back to my congregation and to begin to talk about how we're doing this. In fact, what I'm going to do is take this information that we talked about tonight and send it to my pastor so she'll get a chance to look at everything that we talked about, all of you talked about. And I'm hoping that we get something started in our church, because it's really something that we sometimes leave behind, the mental health issues, because so long the mental health was don't talk about that, not in church. And now people begin to open up, and I like that what's happening. So tonight you all really helped me, and thank you for all of the conversations that went on with the doctors tonight about what's going on, and the ones who talked about what they're doing at their churches. It's going to help me as I move forward and send this information back to our church.
Okay, great. Thank you. Mr. Donaldson, do you want to say something?
Yes, thanks for giving me the opportunity. Hey, we just had a little health fair, but we was only passing out information and trying to get people involved in pharmacy. But the mental health issue is something I've been planning to bring up with the pastor. We having a new pastor. We just he's new as the official pastor. He's been at the church for years, but I think it's something he's definitely interested in. I just haven't had that sit down and talk with him about it yet. Because usually if you go sit down and talk with him, you better be ready to lead it. But he's going on a little vacation, a little cruise for a week, but when he gets back, I definitely want to present him with the information to see what is his approach and see if I can't get him on.
Well, I think that'll be good. And one of the things when Dr. Clark and I first kind of started talking about this, we talked about having, we were working with the Georgia Health Equity Alliance, all the four of us, Doctors Moore, Allen, Clark, and myself. And at that time, we had a drug company that was actually supporting some of the work with that alliance. And one of the primary person we were working with was proposing we did a pharmacy altar call, where one, pharmacists would definitely connect with the clergy to say, hey, I'm in the congregation. And then vice versa, the clergy would reach out to the pharmacist and look for a pharmacist. And I can just say, all of us, the four of us have been in academia for years that are part of this project. But Dr. Thomas, I know you have a long reach between multiple universities and programs as well. And all of us have been preceptors and the like, and we just need to do diligence and making sure that we remind people that the faith-based environment is fertile ground for us both to share our talents, also recruit our next generation of pharmacists, and then also, like I said, change the view and the vision that we have about what we can do, and then certainly help where we can, and definitely volunteering on boards and being on these committees, definitely I think is really important. So there were some great ideas shared. And our last question was really focusing on resources that could maybe provide more support to people. And definitely Pastor Edlow put in as a resource that we should definitely refer people to some of these. Let me see, I'm getting another chat in, so it kind of moved a little bit. when Stacy's came in, hold on. The SAMHSA site, the governmental site, there's a lot of resources there that can actually be used. And I just want to remind people as well that yes, we have a Substance Abuse and Mental Health Services Administration that has a lot of things you can download and print out. You can also get just really the NIH has a lot of really good information and they keep it updated. But the National Alliance of Mental Illness also has a lot of things that they can share. And then what I plan to do with everyone that's on the call tonight is make sure that you get our We Care resource also. But if we also know that we have therapists in our congregations and the like, you know, they definitely, we partner with them because most times they see the patient and to some degree, you know, psychiatrists can prescribe, but the psychologists sometimes can't. But definitely if we lend ourselves to maybe help counsel patients or work alongside them as a consultant in that regard, I think, again, that helps with some of the adherence issues that Dr. Moore, Dr. Clark, as well as Dr. Allen kind of talked about tonight. And so Dr. Moore did comment or echo what I said regarding NAMI being a wonderful, wonderful resource, you know, for us all. So anyone have any other resources that they want to share that they've used? So far we have the SAMHSA site and then we have NAMI. And let me see. Look at this. Comment here. I know.
Dr. Hill, I just want to comment. I don't have much to add to what's been said, but I just have a thought about trying to establish what the word I use is enduring alliances. It can be, you can look at that and interpret in different ways, but it's really having a church having an alliance that's going to be sustainable, that's going to be consistent over a long period of time. And we know that the challenge here is that those things don't remain consistent. They tend to start one way and they may eventually have different reasons why they cannot continue. But it's probably important to have what I call enduring alliances with, and that either is with an organization or even, and the difficulty with getting pharmaceutical companies, there's all these restrictions of how they can be associated with churches, taxes, a whole lot of stuff that comes into play. But having that alliance built in there somewhere where it endures through a period of time, at least dealing with a certain disease state like mental health. And I know there's other areas like stroke and maybe even diabetes where they do these things, but it may have to be made aligned through an organization, through an agency of some sort. And there's a lot goes into that too. But if those things can be established where they provide a service from a source that may have a funding source, a source that may have ability to carry this into another level, will become very important. As I mentioned, I don't think they always last, although we can find them. They may not last all the time, but finding a way that we continue to maintain that alliance with a partner somehow, maybe multiple partners, so that they can help the church meet those needs that we that are identified, and mental health being one. We mentioned the opioid epidemic tied to that. We know there's money tied to that too, a lot of money there. And how we redirect that through means of getting it into a position to meet the needs that we have identified for the community. And I'm not good at navigating it, but I'll be very honest about it. But I recognize the importance of it, that we probably should be focusing on having those alliances.
Okay. Well, I think that's a very important part. And I think a lot of what we were talking about tonight we gave examples where the alliances have been built, but certainly we need to make sure we include the church so that they can actually get some of the resources that they need in that regard. Well, it's almost 8:30, and so in respect to time and everything so that everyone could get on with dinner. I just want to thank our speakers this evening for their knowledge and insight on the topic. Grateful to have been able to work with ABHP on this, but really more grateful about the participation that everybody provided, particularly during the open forum session. I think there were some great ideas, exchanged things we could take back to our respective congregations. But then going forward, I think we also kind of developed a good foundation for further conversation on the topic. So what we will do is follow up is share some of the information about resources that we do have already. And there'll be additional opportunities for these kind of discussions in terms of strengthening the church. And again, it's We Care's mission to really try to help close the gap of health disparities. And we value the role and the contribution that spiritual wellness plays in all of this. And certainly, definitely, if we're not physically well, that can cause mental issues, and vice versa. If we don't treat and address the mental health issues, it can lead to medical problems. And we do know that marginalized populations that we are a part of, as well as treat, always typically become the target, or we have the worst outcomes. And so coming off of the pandemic, we definitely realized we were at stake because of our high propensity for a lot of comorbid diseases. And that's what's feeding a lot of the numbers and outcomes that we're seeing in mental health. So I do think pharmacists can make a meaningful difference. I'm grateful, again, for the dialogue tonight. Dr. Moore put in our chat Mental Health America. Dr. Austin added Pathways to Promise. So again, we'll share this information with everybody once we get off the call. But if you have any additional questions that you want to know about We Care, just reach out and we'll be glad to help you with. So with that, I bid everyone adieu. Anyone else have any questions, comments, suggestions? Or things? Well, okay, well, if not, I hope everyone has a wonderful and safe Memorial Day holiday, and thanks again. Good night.